morning. I'm Associate Professor Datin Dr. Sharmilla. Today, I take great pleasure in introducing Dr. Preet, my friend and colleague of more than 10 years. Dr. Preet has experience in old age psychiatry as well as general psychiatry. She has 3 different yet interesting cases to present to us today. I am sure we'll have an enlightening half an hour ahead. Dr. Preet?
Thanks, Prof. Sham, for the introduction. Hi, I hope everybody can hear me today. Firstly, very good morning. I apologize that my video is a little bit blurry, but that may be a blessing in disguise. Today, I would like to share with you 3 cases. So it's just a summary of the cases that I thought was interesting. And just want to say that as a psychiatrist, before I start, we are very privileged to actually meet with a lot of different types of people. And, you know, we are very privileged to hear and witness all these intimate details about their lives. I think it's very different from other specialties. So with that, I will now share my screen. I hope everybody can see this. So the title for today's presentation is called Never a Dull Day, which is a sneak peek at a psychiatrist's cases. Okay, so the case 1 is about a young gentleman paranoid, and at the same time, he's paranoid and online. Okay, so we'll just start that. This is a case of a 22-year-old male, and his family was concerned with his increasing paranoia and agitation, and this was related to his Facebook posts. A little bit about his history. At the age of 8, he was diagnosed with depression and ADHD, and this was controlled by fluoxetine, which is an antidepressant, until he defaulted round about last year. When he saw us, he appeared disheveled and irritable, and he said that his mood was depressed. He has feelings of anxiety, he couldn't sleep very well, his energy was low, and he couldn't sleep because of this paranoia. He says that something was said on Facebook about a girl, and everyone is in on it. And he also explains that his Facebook friends talk in analogies about him, and reports that I can just tell that that's what about, even if they don't say it directly. So what we can make, a few observations that we can make, is that there's a steep rise in the use of social networking sites. So we know that. And with more than 1 billion users, 75% of teenagers do own a phone, and 22% are logging in more than 10 times a day. I think that can be said for us as well. And internet addiction has been correlated with depression. There are many studies about this, to the extent that there is now something called Facebook depression. Although this is not a DSM-5 diagnosis, there have been scales. One of them has been Virgin Facebook Addiction Scale. So this shows the extent of the problem. Now, going back to this 22-year-old male, we found out from history that he had a long-term relationship that went sour after high school, and he was beginning to suspect that his twin brother, so he has a twin brother who he has an ongoing rivalry with, was romantically involved with his ex-girlfriend. So this is his suspicions. He was becoming increasingly preoccupied with them, and he looked for this evidence on Facebook. So therefore, he intensely monitored his Facebook newsfeed. He interpreted his friend's posts as either directly relating to him or to a new relationship between his twin and his ex. Again, what we can observe is that Facebook nowadays serves as a vehicle through which he could pursue this non-bizarre delusion, okay? So before social media, what people would do is they would either just internally think about it, ruminate about it, obsess about it, or they would start stalking the other person. But now you can use Facebook, as a tool. So social media has provided a means to implicate others remotely. And this slowly expanded his delusion to include more peers, because he also thought that his friends were in on it. And this impulse to repeatedly check social networks, while it may temporarily alleviate some of the anxiety that he feels, this inadvertently perpetuates the cycle of paranoia. So we can see how this happens. This is important to mention because I think many people share the same risk factors. What are his risk factors? So he was becoming more of an introvert. He was becoming more isolated because of this, and possibly his depression had returned. He was insecure and he feared criticism and worried about how others saw him. He had limited romantic relationships. He's only 22, so that may have a struggle. He may have a struggle to develop some protective mechanisms, and hence you can understand where this delusion has come from and why he's so preoccupied with this. And not forgetting that, since the age of 8, his history of ADHD might also be a risk factor for abnormal patterns of internet use, where people with ADHD, they have increased attentiveness with visually stimulating tasks. So these are his risk factors. So how do you manage such case? So his paranoia and delusional thoughts reflect a psychotic exacerbation of his underlying depression. So he had depression, he relapsed, and then he became psychotic. How do you treat this? Antidepressants for his depression, and then antipsychotics for his psychotic symptoms. And through that also there's cognitive behavioral therapy, where a person is offered a range of alternative explanations, and slowly he began to demonstrate increased insight regarding his paranoia and the possibility that he may have misinterpreted the information he gleaned via Facebook. So what's the bottom line of this? This is the take-home messages. So after each case that I present, I will let you know what the bottom line is. It's something that we should all think about and have at the back of our minds. Social media represents a vehicle for relapse for many psychiatric conditions. It's a tool. Young people are definitely more at risk because this is also the time where the onset of psychiatric disorders commonly happens. And patients suffering from mental illness represent a very vulnerable population for maladaptive online interactions. So this is, something that we have to remember. While when we take a history, social media has become a very important question to ask, all the young people that are suffering from any mental disorders. Now, for my second case, I'm going to be speaking about a man who was found to be manic after having found a cure for Alzheimer's, after what he thought he found a cure for Alzheimer's. Okay. A 73-year-old male was admitted to the psychiatric ward because he was not making sense. He was speaking about how he had discovered that high dose of omega-3 fatty acid supplements were a cure for Alzheimer's disease. 3 months earlier, he started taking 10 to 15 grams per day of omega-3 fatty acids because he believed that they were a cure for memory problems, pain and depression, and he stopped all his regular medication. He has a past history of depression and he was on antidepressants, and he did suffer from chronic pain. 2 months ago, however, his wife noticed that he was irritable, he became impulsive, he had grandiose delusions, and he was sleeping very little. Now, these are the signs of a manic relapse. He was driving recklessly because he felt fearless and nothing bad could happen to him. And he was also spending a lot of money on unnecessary items for the house. So what we observed is that he definitely did meet the criteria for the manic episode for DSM-5. He had, however, a long-standing diagnosis of depression prior, and this was treated with antidepressants without a manic switch. So therefore suggesting that he did not have bipolarity. So all this while when somebody is on antidepressants, which you want to treat their depression for, and they do not switch to a manic episode, you are quite certain that what you're treating is a depressive episode or a depressive disorder. But if they switch, then you might be looking at something like bipolar. But this was not the case for this old man. So it is very unusual for a man this age to develop a new onset bipolar disorder, okay, after the age of 60. His disinhibited behavior, grandiosity, insomnia, and psychosis when he had started taking the high dose of omega-3 fatty acid supplements. Okay, so this is what we know. Upon evaluation, he exhibited a lack of insight, and he was saying that his wife was crazy, not him. He had pressured speech. He was very difficult to redirect, and he was very intrusive. However, he was oriented to time, place, and person. What are the observations? His bloods and an MRI done, there were no abnormalities. We know that mania emerging after the 6th decade of life is a rare occurrence. So what else can it be? Frontotemporal dementia? Well, his cognitive tests were all sort of okay. There was no hyperthyroidism. Could it be some substance-induced mania? Maybe the omega-3 fatty acids? Could it be the abrupt withdrawal of the antidepressants? Or could it be a psychotic disorder, maybe schizoaffective? So it was hypothesized that the antidepressant effect of the supplement, which is the omega-3 fatty acids, may have precipitated a manic episode, because a first episode of mania in the 7th decade of life would be highly unusual without an organic etiology. Okay, and then review of the literature found very anecdotal evidence for the induction of mania in clinical trials. What we observed: combination of treatment for rapid response. Because he exhibited quite prominent manic symptoms, he was started on a mood stabilizer, which is valproic acid, and antipsychotics. The choice of which one you choose obviously depends on the patient profile. And sometimes you can just use monotherapy, which is the mood stabilizer, or sometimes you can add an antipsychotics. We do the latter more often. Initial presentation of a manic episode in an older patient is rare. It is important to rule out organic causes. Okay, there is very weak evidence that omega-3 fatty acid supplements may have the potential to induce mania in certain patients. That's the bottom line. I think I may have missed some slides. Hang on a minute. Yes. Let's talk about omega-3 fatty acid induced mania. Having properties similar to SSRIs, that's the antidepressant, omega-3 fatty acids are thought to help prevent depression. This is because it has some anti-inflammatory, some antioxidative, neuroplastic effects. In some studies, it is found to be beneficial as a maintenance treatment and for prevention of depressive episodes in bipolar depression, but there was no positive associations for bipolar mania. And omega-3 fatty acid supplements are not FDA approved for the treatment of depression or bipolar disorder. So basically, there is very limited evidence that omega-3 fatty acids can induce mania. And this association was first reported in 1981. However, the mechanism is unclear. So the hypothesis is that the antidepressant effect of the supplement may have precipitated a manic episode, because a first episode of mania in the 7th decade of life would be highly unusual without an organic etiology. And review of literature found very anecdotal evidence for the induction of mania in clinical trials. So that's the bottom line after talking about omega-3 fatty acids. So it is always important to remember that the initial presentation of a manic episode is rare in an older adult, and it is very important to rule out organic causes. Now, the last case that I wanted to highlight today is about also an older gentleman with very elaborate hallucinations. And because of this, could this be a psychotic disorder? Let's see. A 93-year-old male, okay, he presented to us because he saw and heard people in his home. And because of this, he had bought a knife and he wanted them to go away. This started about 2 years ago with no precipitating events, and the hallucinations are not always there, they come and go. It is always a recurring content. There was a man called Harry. Sometimes there were people coming out of the TV, and sometimes he saw 2 children playing and water covering the floor. So these are, part of his hallucinations. He did not feel threatened by them until recently, and he tried to have a conversation with them, but there was always no reply. As far as auditory hallucinations are concerned, he heard some voices and occasionally heard some noises of paper rustling. With tactile hallucinations, he said that he felt Harry prodding him sometimes, and that Harry knocked things out of his hands. And on the ward, he told us that he sees Harry and says that he pulls out his earpiece. Sometimes he steals his fork, and sometimes he hears a sound like a bee buzzing. So these are quite elaborate, interesting hallucinations. A little bit about his background. He lives alone. He's 93. He's very independent. He's not on any medication. He has not had a past psychiatric history before. And medically, he has chronic progressive hearing loss, macular degeneration, and prior bilateral cataract surgeries. Okay, this is the only significant thing in his history. Evaluation revealed that he was indeed hearing impaired. He was oriented, however. His mood was euthymic. He denied any hallucinations. And a neurological exam revealed what we know: impaired hearing bilaterally and impaired visual acuity. He scored 24 out of 30 in his MMSE, 22 out of 30 in the MOCA, which showed mild cognitive impairment, but this was also quite difficult and it was limited by his poor hearing. His B12 TSH was normal, and his MRI showed chronic microvascular ischemic changes. What we observed: we ruled out a primary psychotic disorder because there was no past history, his thoughts were organized, his affect was reactive, there were no signs of any delirium. So we thought, could this be Lewy body dementia? Well, it could be, but there were no other signs such as Parkinsonism. He was not sensitive to antipsychotics. When he came in, we started him on a small dose of risperidone for the psychotic symptoms. He had one core feature of Lewy body dementia, which was visual hallucinations, very prominent visual hallucinations. But this indicated that Lewy body dementia is possible, but not a probable diagnosis. And he had no other characteristic features of any other types of dementia, Alzheimer's, multi-infarct, nothing like that. So let's look at what Charles-Bonnet syndrome is. Now, this is visual hallucinations in the presence of impaired vision. And this is most commonly seen in macular degeneration, diabetic retinopathy, and glaucoma. These are the 3 conditions. And occurs due to ocular disease, resulting from changes in afferent sensory inputs to the visual cortical regions of the brain. The disinhibition and the firing of the visual cortices lead to this release type of hallucinations of the syndrome. And also severe hearing impairment has been associated with auditory hallucinations. So that's something we should bear in mind. Treatment-wise, well, we started him on risperidone, and then we also added in some Aricept. Maybe this is a dementing process, but he continues to hallucinate without any significant improvement. What we observed, there was no definitive treatment for this disorder. And sometimes you do get remission, but after the underlying ocular etiology is corrected. So this could either be through surgery, the need for special glasses or some contact lenses. Sometimes you do get a remission, but the evidence for treatment with antipsychotics is mixed. Some say it's mixed, some say it's ineffective and only partially helpful. So what works in this syndrome? Changing the patient's sensory environment works, because loneliness and social isolation are major exacerbating factors. Psychoeducation or support groups helps as well, and this is where people can learn coping skills such as distraction, maybe turning on more lights, or even certain movements or eye blinking movements can help sort of reduce these very elaborate hallucinations. So the bottom line with this is that when you are evaluating visual hallucinations in the older adult, please keep in mind the Charles-Bonnet syndrome. It should always be considered, and the major risk factors are always social isolation and sensory deprivation. Behavioral interventions do improve symptoms more often than medication. So thank you. With that, that is the end of my 3 cases. I hope you enjoyed them. And I think we will go back for the question and answer session.
Can you hear me? There is a question here. Should social media be banned for younger people?
Sorry, what was the question?
Should social media, it's from Dr. Chong on We. The question is, should social media be banned for younger people? Or should there be an age by which they can give consent to use it?
Okay, that's an easy and a difficult question. I believe that everything has its benefits. I mean, if somebody also told me that I have to limit my social media, I'll be very upset. And you can't really put a ban on things like social media, which offers also, I think, a lot of positive things. So what would be more important, I think, in the younger age group is to monitor and be aware of what it is being used for and why, so that it is not going to cause any excessive those that are already mentally vulnerable. If you know that there are problems, let's say in your children, if you know that there are problems, so you want to be more vigilant and you want to monitor and to see what's going on. But to say that a total ban, I think that would be depriving them to some extent, because there are a lot of other benefits to using social media.
Okay, we have some more question here from Justin Wong. Do you think we are seeing more of this syndrome during the COVID times when social isolation is more prevalent? Is this the Charles-Bonnet syndrome? I'm not sure because it's not specified here.
Oh, it could be both actually. I don't know, unless I don't know whether 93-year-olds use their social media. Probably not. But I think this would probably be in reference to the first case. when we are restricted, we cannot meet our friends, we can't go out. So what do we turn to? We turn to social media. So yes, that is partly the reason why I highlighted the first case, because I think it's becoming more and more prevalent. And as I said that, when we do take psychiatric histories from patients, especially in the younger group, I think the way that we take histories should change somewhat. And it should include things like social media use, and all the repercussions that could come from that, and all the difficulties that they are having. Definitely.
Okay, so we have another question here from Yu Kuen Chan. Internet addiction is very abundant. How does one reach them when they lock themselves in and refuse to avail themselves to medical assistance? Yeah, I'll repeat. Internet addiction is very abundant. How does one reach them when they lock themselves in and refuse to avail themselves to medical assistance?
Okay, so medical assistance, meaning that this is someone that is medically unwell already, or has a underlying psychiatric illness to begin with, and then they refuse medical intervention? Or is this someone who, it could be your children who are locking themselves in the room and just using social media, recreationally? So there are sort of two ways to interpret the question. If it is the former, that means what I already highlighted, that young people are very vulnerable. So again, I think the monitoring should be there, and also it is very important for adults who are, or maybe parents, to have the supportive role, to be available if these young adults or teenagers, are in difficulty. So I think the support is very important, that they should know that there's someone that they could come to, or highlight any issues to. That's of primary importance.
Okay, so now we have another question from Dr. Chong. Can you enumerate some of the benefits, especially when the child is only 12 or even older?
Benefits
of internet use. I think that Dr. Chong has asked the question earlier, the first question. So this is a continuation to that. Remember, you said there's some benefits, because if you completely ban the internet use, you would be depriving the child.
Okay. I don't know. This is just from the top of my head. Benefits of internet use, educational. I mean, now all schools are going online, so there's a lot of educational benefits as well. I know children learn a lot from what they watch, but obviously everything has an advantage and a disadvantage. They learn how to use computers, IT. This is where our world is heading. If we ban internet use, then things are going to be difficult. I don't know how we're going to progress. So everything, in my opinion, has an advantage and a disadvantage, but it is, I think, very important to learn where the boundaries are. So I think having boundaries for everything, everything is good in moderation. Too much of anything is simply not good. So you can argue it either way. I think everything is good, everything is bad, but it's where you draw the line. I think that is the most important thing that I would like to highlight. And not only where you draw the line, but where the line is drawn and what you can do, and the signs that you can look out for when that line is being crossed. I think knowing about that is super important.
All right, now we have another question from Dr. Mary Merritt. Have we been seeing more psychological symptoms in the elderly resulting from social isolation in the pandemic?
Most definitely. I think in my experience anyway, the incidence of depression has risen. And that's one sort of psychological problem. And the other thing is the decline in cognition, because when you have less interaction, you're doing less, naturally your cognition is going to decline. So most definitely, this social isolation has highlighted a lot of issues in the older adults. And, with the incidence of depression as well, they're isolated from their family members, maybe, and there's less interaction. And, this could precipitate a depressive episode, or, precipitate a relapse in those who are already vulnerable. So most definitely, yes, we are, I think.
We have yet another question from Dr. Chong. How many parents really know what the child is on when on the internet? Like, what are they?
Are you asking me as a parent, or are you asking me as a psychiatrist? I don't know the answer to that question. I think that's a question that all of you can ask yourselves. I put my hand up and I say, I definitely do not know what my daughter is watching on a daily basis. I can't be there all the time. I trust her. I educate her. I tell her what's allowed and what isn't, and I trust that she makes the right decisions. So that's, what we can hope for as a parent. But yes, no, I myself don't know. And I'm sure that is true for many other parents out there. So I agree, that is a challenge.
All right. So on the chat box, we have some comments here from Dr. Chong. The cost of the so-called 15-minute fame created by attention-seeking internet users. Okay. Okay, let me just scroll down. My stroller is... Okay, I don't see any questions here. All right, thank you so much, Dr. Preet. Are there any more questions? If there are none, then I would like to thank you all for listening. Thank you.
Thank you very much, everyone. Have a good day.